A 43-year-old businessman from Mumbai died hours after he underwent a hair transplant surgery.
22-year-old final year medical student P. Santosh Kumar has died following a botched hair transplant.
Okay, you know, there's a lot of talk about Turkey. Going to Turkey for a hair transplant. Going to India for a hair transplant. Going to Mexico for a hair transplant. And why is that? Well, the cost. You know, medical tourism isn't new. It's been around a long time. But you can look at, for example, Turkey. And you can apply this to many of the other countries. Now, in Turkey, I know a handful of surgeons who are very good. But they certainly can't handle all the patients who are going to Turkey. The fact is that in Turkey, there are probably 1,000 hair transplant surgeons who are not good and, frankly, are not where you want to go. So here's my experience dealing with patients who've gone to Turkey. The first thing is they will recommend about twice the number of grafts you need. And this immediately doubles your cost. When you go, they don't perform twice the number of grafts you need. They wind up doing about half. And they spread this half over a very large area. They build exceedingly low hairlines that are not consistent with someone who has advanced degrees of hair loss. For example, a Norwood class 3 vertex who's moving to a class 5 doesn't need a 6 centimeter broad hairline. First of all, broad hairlines are seen in Asians, and they're seen in African Americans and people of African ancestry, but they're not seen in Caucasians. But that is a Turkish hairline, a broad, low hairline. So the patients come back from Turkey. They have these low, broad hairlines, very thin density. And in a patient, for example, where I might recommend 2,000 grafts for the front, they might recommend 4,000 grafts for the whole head. And they do about 2,000 grafts. But then when I look at the donor area, it looks like they attempted 5,000 grafts. So the patients come back with unnatural low hairlines. They come back having spent double what they should have spent for what they got. And they come back with donor areas that are decimated. And that's when they call me. And I have to say, well, unfortunately, your donor area is ruined. You don't have the hair left to finish the transplant. And your real only solution now is to remove everything that's been placed there and try to put it back in a more conservative fashion. But even that becomes quite difficult. The hairlines aren't natural. They contain multiple 2, 3, 4, 5 hair grafts. They're broad and low, and the donor areas are depleted. So I would be very cautious about going to Turkey or India or some, Latin American countries where, the educational standard to begin with isn't that high. The average nurse in Turkey is making about $1,000 a month. So it's somewhat slave labor in a sense. And becoming a doctor in some of these countries is not a high-paying job. So they don't attract the cream of the crop people in these countries to these positions. And they also lack, to a large extent, the ethics that, we come to expect from our medical professionals. And so they will cheat you, they will destroy your donor area, and they will make you a cosmetic cripple for the rest of your life. So be very careful.
Forhair is run by Dr. Cole with 30 years of hair restoration experience, and we offer the most cutting-edge technology available. In fact, the Forhair Enterprise sub-company Cole Instruments manufactures custom-made tools and automated tools for hair restoration physicians all over the world. Our quality, expertise, and skills are superior to other clinics. Our reputation and results are the best in the world. It's time to restore your hair. It's time to choose Forhair.
We hope you enjoyed the video. Don't forget to hit the little bell button to get notifications of Forhair's video uploads. For online consultation, click on the link on the screen or in the video description.